Does telehealth reduce carbon footprint from patient travel? Imagine a world where visiting the doctor doesn't mean sitting in traffic or filling up your gas tank. That world is becoming more possible thanks to telehealth. When you think about healthcare, you might picture long drives to clinics or hospitals. But with telehealth, many of those trips can be skipped entirely. This is a big part of the benefits of telehealth, making healthcare more accessible and environmentally friendly. Every time a patient uses a telehealth platform for a routine checkup, follow-up, or mental health session, they avoid a car trip. On average, a telehealth visit can save a patient from traveling between 17 and 49 miles round trip. The exact distance depends on where they live and how far they would have traveled for care. For people in rural areas or those needing frequent visits, these savings add up quickly over time. The environmental impact of fewer car trips is significant. When fewer vehicles are on the road, there are fewer greenhouse gases released into the atmosphere. For example, data from the United States shows that widespread use of telehealth has helped avoid millions of kilograms of carbon dioxide emissions each month. That is roughly the same as taking tens of thousands of cars off the road every month. Telehealth platforms and remote patient monitoring tools make it easy for patients to connect with their healthcare providers from home. These tools are especially helpful for managing chronic conditions, mental health, and post-surgical care. They allow for regular check-ins without the need for in-person visits, saving time and reducing emissions. Setting up a telehealth appointment is simple. Patients usually receive a secure link to a video platform, log in at the scheduled time, and meet with their provider from the comfort of their home. It only takes a few minutes to connect, and no travel is needed. While using devices and internet connections for telehealth does requiring some energy, the emissions from these activities are much lower than those from driving a car. The overall effect favors telehealth as a way to cut down on transportation-related emissions. From the perspective of healthcare benefits, this means patients can get the care they need more easily while also helping the environment. Telehealth platforms are designed to be user-friendly, often requiring just a smartphone, tablet, or computer with a camera and internet. This accessibility makes it easier for everyone to participate, including those with mobility issues or living far from clinics. The amount of carbon footprint saved depends on how often telehealth replaces in-person visits and how far patients would have traveled. Supporting telehealth infrastructure and policies can help keep these environmental benefits going. For patients, choosing telehealth when appropriate is a simple way to help reduce personal carbon emissions while still receiving quality care. In the end, telehealth clearly helps lower the carbon footprint from patient travel. It makes healthcare more convenient and sustainable, especially for routine visits, remote monitoring, and mental health services. This approach aligns with the goal of providing good care while protecting our planet.